Good evening, everyone. Myself Priya Sivlani, here about to teach you some topics about anti-cancer drugs. What we are gonna learn today, the classification of anti-cancer drugs and general toxicity about anti-cancer drugs. About cancer. What we'll learn now, what is exactly mean by cancer? Cancer is a disease of cells characterized by progressive, persistent, purposeless and uncontrolled proliferation of cells. That means cells divide in an uncontrollable manner with respect to cell division. So first we'll see what exactly the normal cell process go through. This is the normal cell development. Every cell in a phase of cell cycle has four phases, and after undergoing those phases forms a normal healthy tissue. But when abnormal growth occurs, that means when a normal cell undergoes some genetic changes like mutation or any radiation effect, it leads to formation of a cancerous cell, and this cancerous cells by evading our immune system like the macrophages and the neutrophils and by showing the property of contact inhibition, these cancerous cells evade the immune system and lead to formation of a malignant tumor which spreads all throughout the body, and there is development of a condition known as cancer. There are many agents that cause cancer. It could be chemical agents, physical agents, or any radiations also. This is how the immune system interact with the cancer. As seen, cancer cells are rapidly dividing cells, so they evade the immune system very fastly because of their effective mechanisms. Now, the classification of anti-cancer drugs. First is the alkylating agents. By alkylating different groups on DNA, they inhibit DNA replication and breaking of DNA strands, resulting in death of cancer cell. That means the main function is to inhibit the division of cell, that is inhibit the DNA replication so that the cell do not grow and its growth is inhibited and cancer is also inhibited. First comes the nitrogen mustards, that is mechlorothiamine, cyclophosphamide. In the same class, ethylenamine, thiotepa, ultratamine, triazine, dicarbamazine and temoclosamide. Then comes the class of antimetabolites, which is our second class. They inhibit formation of nucleic acids, which is a really important mechanism because by inhibiting DNA and RNA, again same, they lead to inhibition of cell division of the rapidly dividing cells. First comes the folate antagonist, methotrexate, pemetrexate, then the purine and pyrimidine antagonist. Purine antagonist consists of 6-mercaptopurine and 6-thiaguanine. Pyrimidine antagonist consists of 5-fluorouracil, which is the most common drug used now as an anti-cancer drug, doxyfluoridine. Then comes the antibiotics. They'll also block the transcription of DNA. Actinomycin D, doxorubicin, edarubicin, epirubicin, mitomycin C, eclarubicin. Then comes hormonal drugs, glucocorticoids, anti-androgens, GnRH analogs, estrogen and progestins. So we'll come to our main topic, that is general toxicity of anti-cancer drugs. So we'll know what is the main mechanism of anti-cancer drugs. By inhibiting DNA replication, they inhibit the normal cell division of cells. So rapidly cancer cells are not allowed to divide. In the process of doing that, our own body cells are also categorized in the process of rapidly dividing cells. So it kills our own body cells also. So our body tissues are severely affected after the treatment of anti-cancer drugs. So the toxicity which I'm going to discuss here will be the general effects, but the individual side effects they are also present. They'll also be seen when we'll discuss about their respective classes. So my main topic here is to discuss the general toxicity. So let's go ahead. First and the most important is bone marrow suppression. It results in granulocytopenia, agranulocytosis, thrombocytopenia and aplastic anemia. One by one we'll understand the meaning of these terms. Granulocytopenia, that means decrease in WBC count. Agranulocytosis, that means decrease in WBC count along with no formation of WBC cells. Thrombocytopenia and decrease in platelet count, and aplastic anemia is a type of pancytopenia in which 3 of the cell lines are decreased like RBC, WBCs and platelets. Patients undergo recurrent infections That is really an obvious situation because WBC counts are decreased, so patient undergo a really recurrent infections, and bleeding manifestations are seen because platelet count is reduced. What will be the respective treatment? If platelet count is reduced and bleeding manifestations are really common, do platelet transfusion for stimulating the growth of WBCs, give granulocyte stimulating factor, and same for stimulating the growth of RBCs, give the hormone erythropoietin. Then comes the immunosuppression. As discussed, they decrease the WBC count. WBC contains a main class of cells which are known as lymphocytes. And when lymphocytes are decreased, that means there is decrease in T lymphocytes and B lymphocytes. When T lymphocytes are decreased, there is decrease in cell mediated immune response, and when B lymphocytes are decreased, there will be no formation of antibodies, and humoral cell response will also be diminished. So such people are really prone to opportunistic infections. Opportunistic infections means that infections were not present in normal individuals, but because these individuals are on immunosuppressive drugs, so in those individuals that diseases and symptoms are really common. So infections with candida, which is a fungal infection, herpes zoster virus, cytomegalovirus, and toxoplasma parasites are really common. Then comes the GIT manifestations. Due to stimulation of CTZ in brain, nausea and vomiting are the most important side effects. And cisplatin drug has the most emetogenic potential. That means when taken a treatment of cisplatin, it causes maximum vomiting symptoms. Treatment for such drugs will be, you should use ondansetron-like drugs, which is a class of 5-HT3 antagonist, which are really effective in chemotherapy-induced vomiting. Then comes the stomatitis, which are mouth ulcers. I've shown you a picture here. You can just give a look at it. GI bleeding and ulcers are due to necrosis of rapidly dividing epithelial cells of gut mucosa. Because these cells are also destroyed, so GIT bleeding is really common. Then comes our organs like the gonads. Testis and ovary are really affected. So due to affection of the testis, there is oligospermia, decrease in sperm count in man, and in females, most common manifestation is amenorrhea. And these drugs carry the highest teratogenic potential. That means when these drugs are administered to pregnant ladies, it causes really adverse effects in fetus. Skin, due to damage to hair follicles, alopecia is a very common symptom which we see nowadays with the treatment of anti-cancer drugs. Hyperuricemia, because there is a destruction of purine and pyrimidine metabolism, there is breakdown of purines, so there is increased synthesis of uric acid, and in such individuals, occurrence of gout is really maximum, so anti-cancer drugs should be avoided or should be changed accordingly in respect to the gout scenario. This is a overall chart of how the chemotherapy and the anti-cancer drugs affect the whole body. Starting from above to downward, hair loss, which is a common manifestation, pain, mouth sores, trouble bleeding, nausea, vomiting is a symptom of GIT. Immune system is already weakened as discussed earlier, constipation, diarrhea common, bleeding, rashes, and neuropathy can also occur. So, are you ready for giving a test? Okay. We'll see some MCQs regarding the same topic which we have discussed now. So the first question is, which drug has the highest emetogenic potential? So I'll read the options: ondansetron, ranitidine, cisplatin, and bevacizumab. We have discussed that cisplatin is the answer. It is the most emetogenic potential, but we'll just look at the other drugs. Ondansetron is used for the treatment of chemotherapy-induced vomiting. Ranitidine is a drug which is given in peptic ulcer treatment, and bevacizumab is an antibody-like type drug which is used in cancer, which is not used in cancer, but which is used. It is used in cancer, but not for the same purpose, like the emetogenic potential. All are alkylating agents except melphalan, mecloriphamide, cyclophosphamide, and cisplatin. So it generally comes from the classification. Cisplatin is not the drug which comes under alkylating agents class. Next MCQs. Which among the following is not the side effect of anti-cancer drugs? We have discussed the general toxicity, which was our main topic. So we'll just read the MCQs and the options. Vomiting, aplastic anemia, stomatitis, and blurring of vision. So, Vomiting is a side effect along with aplastic anemia and stomatitis, but blurring of vision is not the side effect. It is a side effect of some anticholinergic drugs like atropine. Fourth question. Breakdown product of purine metabolism is carbohydrate, fats, uric acid, urea. Uric acid will be the answer. Best drug to treat chemotherapy induced vomiting. We have discussed ondansetron is the best drug. So I'll take your leave. Thank you.